research person ni kan somhal may ang akong tere lozog na.
So we'll start with the systems. So as we all can see, there are around 11 systems in our body. So we have, starting with the digestive system, then we have muscular system, we have integumentary, lymphatic, endocrine, nervous, skeletal, reproductive system separate in male and in female, respiratory, urinary and circulatory. So we'll start with one system, and the common diseases we get in those systems along with the product combination. So this system together makes up our human body. And whenever we have any disease, say for example, in case of circulatory system, if there is any issue or any problem with the heart, the way heart beats, the rhythm, or if there is any blockage to the supply of the heart, if there is any problem in the muscles of the heart, if we have blood pressure problem, hypertension, or if there is deposit of fat in the arteries or the blood vessels, this all comes under the circulatory system. So like that ways we'll go system wise. So here I'll be explaining about the systems and then the diseases.
Heta hianin na sinakanin taksa enge sel atranga ain atsuklak sona nakasuya kan taksa hin system sang ong katia kanin henghowi kan system nei kachunia ama sabera hian digestive system puilam pang anita chuanin muscular system kan tisol integumentary system om je chu kan fun kan skin akhanita ni chuanin lymphatic system hi chu kan taksa achunga nochong hetiakal englo impas na khanita so endocrine system a hi chuanin endocrine a chuanin enge ka thyroid kan ti te khatiang ho kha om na khanita so nervous system nerve te chu kan shafek ta nervous system nerve om na kam system a khani boka chumi so a skeletal system om je chu kan ru te to te khatiang ho na khania male reproductive system om je chu male reproductive system a chon mi pala me che chon self in ang lo ve kan nia kami sera po khanin chi sang i peng sang om ta kami me chetan big le mi patan big ka dam loi to ta kha soidona chuan hemi respiratory system kan om je chu chuap lampang kan thok bom lampang khanita urinary system hi chu kan sum kong le talte aniang chu chuan atopa circulatory system kan ti hi chu circulatory system a chuanin kan ama sabera kan thokalom hal chu kan lung hi kisan pam tu poimo peronita hemi hi akisel lo chuanin bp sang te kan nei shin ta ni heart attack te mo khati kha kan nei shin ta chuan circulatory system a pakhat kan boile na bok chu cholesterol level sang awanga kan artery kan thisen zungzam enge hetia bana kan en mei chuan kan po hi vein ani mase alo lang chin lo hetia kan mea aphudat tak om na lai kha kan artery kan tia chunia kami artery sa khani thau che na block alo om chuan khatiang block khani heart attack te stroke te mo heta block thingin hoi boi vek thinda kha circulatory system toya om ho te chuni.
Before we start with the first system, that is the circulatory system, here we'll talk about antioxidants, free radicals and oxidative stress. The most talked about topic nowadays, because many people say that we need antioxidants, there is oxidative stress inside our body, we need to cure it, or else that will lead to damage and destruction of all our tissues and organs. So as we can see in the left, that side, second picture in the down, so there is written antioxidant and free radicals. So free radicals are those electrons, or we can say those atoms or molecules which have an unpaired or an extra electron. So when this is not paired, when the electrons are single, they are more reactive. They take part in reactions, and that we call as oxidative stress, which leads to damages in our body. But what will antioxidants do is, they already have an extra pair of electron which they can donate. So they donate that pair of electron to the unstable free radical, they make it get paired up, and then they become less reactive, and then they don't cause the damages which they would have caused if there was an extra pair of electron. So this free radicals can be as a result of our unhealthy lifestyle, diet, stress, genetics or environmental factor, and it might be because of pollution too, which comes in the environment category, whether it is air pollution or soil or water, because daily we are consuming chemicals and toxins. We don't directly see chemicals and toxins, but it is present in the air we breathe, in the water we drink, and in the food we take. So we can't only say that if we have food from restaurants or if we have fried item, junk food, only that will cause disease. Even the fruits and vegetables which we are purchasing from the market are full of chemicals, like it has insecticides, pesticides, fertilizers, etc., which are used during the time of cultivation. So that, and also nowadays many chemicals are added to keep the fruits and vegetables look fresh for a longer duration of time. So daily, every second in fact, we are taking in toxins, whether it is through air or the water or the food we take. The heart won't get blood which it should get per second. Heart won't pump, it won't function. It may lead to stopping of the functioning of the heart. There might be heart attack, there might be sudden stoppage of the pumping action of the heart, it might lead to cardiac arrest. Again, if this happens in the brain, we have blood supply to the brain as well. Brain, there are cells. If that happens, the brain cells will die, will start dying immediately. That we call it a stroke. Again, there are two types of stroke. One is because there is some blockage to the blood supply in the brain. Other is because there is maybe bursting of blood vessels or bleeding. We call it hemorrhage. So whatever may be the reason, what we should know is if the blood supply is proper, we will not have diseases related to circulatory system. If there is problem with the blood circulation, we will have diseases related to where the obstruction is or which organ is not getting blood properly. So depending upon, so there are different names. It all means the blood vessels might be affected. For example, in coronary heart disease or triple vessel disease, which means the main blood vessels which directly supply or are connected to the heart, there will be some problem with that. There will be some blockage of blood supply through that, and because of that, many people undergo surgeries related to the heart. For example, they undergo bypass or stent placement, etc., which means there is no proper supply. So an additional road, a diversion has been made because the road through which the blood was flowing, maybe there is obstruction, blockage, damage, another route has to be made. So they undergo those surgeries because without blood, we can't survive. That is why we should be very aware of our systems, and we should know that in our body circulation is important. How we maintain our hemoglobin level, how we maintain the circulation inside us is very important. So only we have so many products which improves our circulation. We all know we have wheatgrass which increases the circulation, but apart from wheatgrass, we have many other products which I will show that increases. So whatever disease it is, blood supply should be proper. When our cells don't get proper blood and oxygen, we feel very tired. We feel as if we have no energy to work. We feel sick. We feel ill. So ultimately, it's very important for us to maintain a healthy circulatory system. So white blood cells are basically the cells which help in fighting germs, or we can think it as bacteria, virus, etc. So red blood cells, white blood cells, all of this are produced mainly in our bone marrows, or we can say the bone marrow is present inside our bone. So the components of blood are produced there, and mainly whenever we have an infection, our body will automatically detect it, that there is something infection inside our body. So henceforth, the process of increased production of WBC will start. We can think it as the immune system or the lymphatic system will be continuously monitoring. Suppose for example here we have police etc. authority who will keep on patrolling and monitoring whether everything is correct or not. If there is anything which the body recognizes is not a part of our body, it is a foreign body, it is harmful to us, it automatically sends signal. After that, many such cells production will start, and all those cells falls under, we call it WBC, white blood cells. So their main function is, it will be high if in case we have any infections. It might be any infections, it might be infections related to our blood or lungs or urine or liver or any infection. The WBC production will increase. Whenever there is anything inflammation going inside our body, anything damage going inside our body, or anything foreign body inside, invaded inside our body, the WBC production will increase. Also, in cases of cancer, because cancer is something we can say, the cells start multiplying at abnormal rate. Normally, our cells divide at a regulated rate, but in cancer we can just think at an abnormal rate the cells are multiplying. Some cancers are in a particular part or an organ, some cancers spread, we call it metastasis. So any condition, whenever we have an increased infection, inflammation, infection might be because of some cases, we call, like for example by parasites, or for example like malaria etc. Or we can think it is any other infection by virus, bacteria etc. WBC production shoots up. This is the defense mechanism our body makes so that it can provide us protection by killing those organisms. So it has become very necessary that we try to save and prevent ourselves from getting the diseases, because we don't only stress and focus on curing. The first step which we focus on is how we can prevent it. If we can prevent it, then we don't have, then the disease won't progress to that level. If in case we get a disease, then of course we have to do the treatment. But here, why we suggest the product Total Antioxidant in each and every patient or a healthy individual is because every one of us, inside us we have this oxidative stress and the reactions going on, which leads to consecutive damages in the future. Maybe in a day or two, if we are healthy now, we may think we are fit and fine now. We don't have any disease, but there is no guarantee as that we won't get any disease in the future. So that is the main reason we suggest the product Total Antioxidant in almost each and every one of any age group.
In tinge that nakakan na how crucial is antioxidant for us. Antioxidant so in shabang ataro total antioxidant kan pangkat kan event to bang parlokang total antioxidant ka engat tinge kan na chan so yanga sumikan na chana chonin omsia chon na chi na ka soile bok cell kan ti kan taksa poimo perakha khata khanin electrons kan ti he tianga atoms anga electrons atoms le protons itu mizo trong soi bak ngai na ka thelo ma se hemi thil bia la ki kimia kiamin akal kol ta ni enge omsia chunin chemical anga lo ngai bula chunin hemi unpaired omsia chu pair nei lo ang takhan akal ta pair nei lo a hemi electrons ang hi kan cell chunga khanin ave kolin ave kola a om khan enge kan taksa a thil thalo alo thlem thin ta ni chu he unpaired electrons kan ti hi engtin nge kan taksa chunga alo om engwai nge lo om very mot chu karang soi bokang chuan shet du masak zok tura ka soi du chu total antioxidant kan pek khan hemi electrons ho per pui nei velo mo single ho ni chu nupui pasal la nei velo ho kha an mani chawa khatianga an vei kol khan thil chia kan ma thlen thin ta khang ang thil kan taksa chia ma thlen thei turanga kha hemi antioxidant kan aya kha electron cell level thenga na asuk thok thei ta ni khami kan cell timur chung te a khanin khati ang per nei lo ho kha per kha asuk siam pui mo hemi electrons free radicals ta na nupui pasal to om takalo ni daw tinani chu kha anron in nei khan kan taksa khani equilibrium om se chu thil in balance lo oma kha aro in balance don tani so hemi free radicals kan ti na china he per pui nei ve lo ho local gol ve ho ki pui tangen local an local gol na chan ber chu masabera chuan zu kan in te apathina chuanin meizial kan zuk te sada kan huam te tuipur kan huam te mo mizol chuanin zuk le mo ma chung kan ho salut tuk mo nei lo kan nei lo chu wang chuan ma se khang ho khan engam takin ye kan taksa hian in chiat na hle a chan chu voina chuanin ka risel iti mei thei nat na kan nei lo iti mei thei ma se kha kha za 100% in tu man guarantee an pe thei lo che keima le keima po ke in pe thei lo wa tu ma me dang po in pe thei lo ek teknia mo chuanin tam lo na kan nei thut thei kan taksa hi mani le mani in anat thuna pa kan feel thei lo aron nat ma a prevent da na kha ti dam ai na poi mo zo kan ichu chu wang chuanin nat na hi nga her tur ni lo wa I hemi nat na tam tak kan do the hi chu prevention is better than cure kan ti ang khanin hem nat na kan kasa chunga lo thlet ma khan I lo ti dam enge antioxidant ate ti ang te lo eya na china yoga ka soeng te regular exercise nei te mo he Oriens dam doy kan ani chuanin I regular exercise te kan lama taksa in soi zoi turania kan le in kan fim purbokanga kan le ina khanin I enge mizo so pe hi chu le min a basic dawa omzia chuanin hei thil uite thakluk tuk te momlu tuk te khatinga kan nga wa ma se khak po kha tle ma kan modify thei chuanin ei tamlu tuk lo khanin tur khanin kai control theya ti chuan kan zuk le hom remote lowa po air pollution kan bo ruak hi blu po hi tuna hianin a risel to lowa kan ozone po hi a pok to a kami ni bang khanin UV rays atang po hian kan huna na tam tak ni atanga zoom ni zoom atanga natna ranom thei po tam tak kan nei to a chuan kan thil ei po na KFC te kan nei to ta po la phang thil kan ei po kha a thiam tim chiang am ti po a shet lowa chung kami mai ne lo mani chung kan thil ei kha resel tur ang ringo ta kan nei po entirnanin chope te bazar train kan lei ta bazar tanga chope kan lei kha engam takin nge an cultivate hun I anlak chope kha ai ramatang anlak ma khanin I khamit thaya kha I enge chemical kami pesticide le insecticide ta flow an ka ang thin kha khatiang kha ka tun lai a chon ani to thina wangin thataka kan lo sil fai lo ni phesong kha khani ka taksa he free radicals mo khatiang ang toxins kan ti lo mo kha asiam ve thei boka chuan I kha ang song song kha I kha ang song song khan enge athen kan ti chuan I kan taksa a na china free radicals no pui pasal la nei lo ho khan enge athan ti chuan kan sel la khanin oxidative stress alo siam tani stress tam tak apeta mishing po ke mani po stress kan nei chuanin kan na mai stress kan na lu chuanin eng nat na ngai lo thang tur po thei lo kan na kop mai ni khade khan kan taksa nat na thlet tu kan ni lo te kha atha ni chu ma se hemi ka choi jong jong khanin I tuna khanin ka soi jong jong atanga film ka chu za pakhat vel rek po kan za pakhat vel ba kan nom lawa chu wang chuin total antioxidant hi enga tinge mi jong jong kan pe nga tinge I tura kan ti vek na chan chu ka soi jong jong akha tu ma kan film lo e vek ngai ti na ni chu
System. There we have glands which secrete hormones. Among those glands, we have one gland which is the thyroid. We have the thyroid gland in the base of our neck region. It is like a butterfly shaped gland which secretes and makes thyroid hormone, mainly T3 and T4. If we see any report, we will get, in most of the report, we will get TSH, T3 and T4. So here, the other glands which are there in the endocrine system, we have hypothalamus, we have pituitary. Thyroid gland will make and release hormones indirectly in the blood that will be detected by the hypothalamus, and the hypothalamus will secrete GnRH, which will go and tell the pituitary what to do. Now pituitary gland will release a hormone named TSH. thyroid stimulating hormone. So the main work which will be going on here is maintaining the balance in our body, balance of T3, T4 in our body. If there is more thyroid hormones in our body, automatically the hypothalamus will tell the pituitary to secrete less TSH, because more TSH means more T3, T4. So T3, T4 is more, then TSH will be less. So if there is more of T3, T4, we call it hyperthyroidism. Hyper means more. So if in the body T3 and T4 is less, we call it hypothyroidism. If T3 and T4 is less, automatically the body will come to know there is less hormone, more hormone needs to be produced. So in that case, the hypothalamus will tell the pituitary, to make more of TSH. So it's like if T3, T4 is less, TSH will be more. If T3, T4 is more, TSH will be less. So basically, what we say, it's hyper. Hyper means thyroid hormones are more. Thyroid is making T3, T4. So hypo means thyroid hormones are less. So we have different symptoms in hyper and hypo. Also, the problem always might not be in thyroid. Sometimes there might be some tumor or cancer in the pituitary, which will alter the signals. As a result, the values will be fluctuating, and exactly it might not be any disease in the thyroid also.
T3, T4 และ TSH กันเสียงที่นี่เสียชู T3 และ T4 เขาเคยเงี้ยคอนโทรลกันที่ส่วนให้มีการช็อกบกสู้กับเรื่องการไทรอยด์แกลนที่เราทราบให้มีไทรอยด์ที่เสียชูฮอร์โมนที่ที่เป็นส่วนต่างถ้ามีฮอร์โมนเป็นส่วนต่างไทรอยด์ stimulating ฮอร์โมนนะครับเอาด้าน TSH กันที่ครับส่วนถ้ามีbalance ตัวอินเนสซิกนัลก็เป็นตัวกันที่ส่วนนี้ hypothalamus gland ที่นั่นสินะสไลด์hypothalamus gland อารมณ์ดาค่ะอันนี้ดา hypothalamus ค่ะนี่เอ็ดอันนี้ hypothalamus สุดท้ายที่ตาจุ่มลำพังให้กับพวก TRH stimulating release of TSH pituitary gland กันที่ให้ตายมีขณะนี้ hypothalamus ค่ะนี่ signal ค่ะกัลตา hypothalamus ค่ะนี่ T3 และ T4 ค่ะตักษาที่ติดกับเราเอาอินสานง่ายอารมณ์เดีย T3 T4 ค่ะนอนสานวักส่วนนี้ TSH ค่ะอารมณ์เดียมโดนตา TSH ค่ะเดียมส่วนยังไงกันติค่ะ TSH ส่วน hypothyroidism มันนี่คือ hypothyroidism มาส่วนนี้ซิมตอมพวกค่ะอันดับตา hypo ส่วน hypo ที่เนี่ยชิมมาส่วนนี้กันตักษาแต่เราจะว่า hypo กันในส่วนนี้กันตักษาเราจะว่าติดส่วนนี้มาเส hypothyroidism และ hyperthyroidism มาอย่างนี้ซิมตอมนั่งเดียวเอาแต่เท่าอินโทรของแต่มาเสมาสับเปล่ากันพูดเฮียมาเสยังไงกัน differentiate กัน tension เห็นนะเสียงมาสับเปล่าส่วน hypo ส่วนนี้ยังไงกัน metabolism มาค่ะ slow ตากัน digestion เตะกินเตะ slow บางครั้งนี้เอกเทโลเอกสักครั้งที่จะพอค่ะตามาที่ส่วนกัน fat พอค่ะ burn ใช่ไหมเทโลถ้าบางครั้งนี้เผาเสียค่ะเสียคนตามา hypothyroidism แรงส่วนนี้อันเผางาอัน obesity obese กันเตียงหันตามาส่วน orpor กันเตียงสิกันน้ำปกตาส่วน hyper เวทุงัดส่วนนี้ metabolism ค่ะสักเล็กที่พวกวางอันเสียตาอันที่เอียพอค่ะอันตักษาขนาดของขบโซโลวะที่ส่วนนี้อันตักษาค่ะอารมณ์เสียตับฟักที่ส่วนนั่นสินะ hypo กันที่ส่วนส่วน hypo ส่วนนี้ cold intolerance นั่นสินะก็ตัวนี้อารมณ์สวยเขาหวังค่ะนี่วดอันเตะเทลวะหุ่นวดอาบน้ำเทลวะสร้างอะไรที่ยังข้ากันสวยตัวขณะค่ะนี่ดำโดยกับเป็ดเทียจูseven wonders juice ข้าอารมณ์สวยตัวองเสียจูกันตักษา metabolism ส่ง regulate ตัวติดชัดตัว balance เสียงตัวข้านิตาติดส่วนนี้ชิลาจิตพวกันเป็นเดลเทีย total antioxidant พวกันเป็นเดลเทียติดส่วน hypothyroidism มันติดส่วนเผาเสียงเผาไงโดนตักขมิ้นเผาตัวกันส่วนนี้healthy slim กันเป็นเดลเทียส่วนอันเอกแต่อักขลุตุกแต่ในส่วนนี้ healthy intestine แต่หากันเป็นเดลเทียพวกเขาติดส่วนอันมานินโซอันเอกฮัลโลวา enge real tram te an nei lo ni chuanin fruit fiber te kan bedel thei boka khami ba ka khanin ayurvedic medicine na ashwagandha te triphala te to kanti te khati ho kha apek te thei boka ni chu kan treatment kan apek ko khan hyperani mo hypo ani mo khata khanin shilajit te 7 wonders jutsu athok ve don shima khata khanin symptom khan cher lam pang kha chu hyperani ta thau lam pang kha chu hypon me ta an thau chon healthy slim betelanga an cher chon choi tuina fruit fiber te healthy slim te betelang khata khanin a difference chu an endinanin cher kherlo mo thau pha kherlo hey tak sapa ai to te pok kan te mase an choi tuina te lo bo chuan fruit fiber mo nan sina ka soi healthy intestine kan dia kha apek te choi tuina work ko tina ni chu chuan nerve saklo metabolism englo saklo tan te kan soi ho ang song song ko kha pe ko ma se kami hearing capacity kha tinglang pa kha ine kha aniam tina ni kami duratan khan kan doktor kan so pa da hoina kan ke sa liwangin ai kat so ama ina experience asha te polo nei me theya kami ka soi dir pa ta chon chu zo karon chu zom nan ni
So hearing capacity might be affected because of many reasons. We have three parts. We have the outer ear, middle ear, inner ear. So whenever we have any infection or more of ear wax, or suppose while bathing and all, water goes inside, this and all might affect our hearing capacity. Apart from that, our nervous system is associated with it. So in our inner ear, we have certain structures which help in converting this sound into electrical impulses or signals which are sent to the brain. So if there is any problem with this system which converts and sends these signals to the brain to analyze it, there might be decrease in our hearing capacity. So this happens. So in many people there is sensory neural hearing loss. The nervous system is affected. So this is also common in people as they age, or sometimes if we are exposed to very high frequency or very loud sounds or noise. Sometimes because of sudden change in pressure, there might be a problem too. So whatever is the cause, we have to strengthen our nervous system. So we can use the products which are very good for our nervous system. If the membrane is fine, if there is no earwax, no infection, nothing, then the problem might be with the impulses which are sent. So we can use Panax ginseng, we can use ashwagandha, we can use brahmi, we can use total antioxidant, we can use 7 wonders juice in this case. If with age we get a lot of problem related to our eye and our sense organs, we need Moringa also in those cases. So Moringa is like a multivitamin, multimineral. So whatever deficiency is there in our body, it will help in that cases. So as an additional support, we can add Moringa too. So but basically first of all we'll go for strengthening our nervous system. So we start with total antioxidant, ashwagandha. In place of ashwagandha, we can add Panax ginseng, brahmi, and we can also use calcium too. Calcium helps in this process in which the nerve cells communicate. Calcium is not only required for our bones, but also for our muscles, for our heart, for the transmission of signals from one nerve cell to another, for our brain functioning, you can say. So we can add calcium in that case too.
Kan beng sunga hianin beng chung le alai le apono ta kada khan kami pur akhanin engo infections te po om theita antinanin bacteria infection te po lo om theita khama wang khanin beng shiat na ti boy te po om ve theya kan beng da ni chuan bank ek tam lu tuk te bank ek tam lu tuk te khan in shiat na kha hemi bank ek aron tam tak tak chuan in bank ko hi ano hui ve thei ta chuan khami awang khan in shiat na kha atitlem thei boka chuan pakhat le om thei chu khang ang zong kha eng ma om lo ni chuan kan nervous system ani mai ta om se chu kan bank kan shiat ni chu kan thok atang signal ron in be ni ta kan nerve signal pakhat rong kala ka he rong kala ka kan bank te poi kan thok te ne na in som ka kan ya kan mit te po thok te ne signal khami ai in pe to ra khami nerve signal kha aron chak lo na ne khami nervous system chak lo ata na kan pe ho ha pe mai to ra ni ta chu ta zone ne ama sabera nervous system mi bank ni chu nervous system mi an ye wa ni total antioxidant kan pe anga chuan ashwagandha te po ei tel theya panax ginseng kan tiang te po ai thei boka chuan brahmi chuan calcium po affect tel theya om sia chuan calcium hi ru tam chaw ni lawa a chan chu calcium hi kan nerve tan te po a thok veka kan muscles kan tissue tan te po he hemi kan beng sunga mi hi enge ri ron siam khom tor chuanin beng te po tissue chikhat anita ti chuanin beng ru te po ta kan beng ru nawang te po kha kami component na calcium ma tel veka wangin kami riat na nervous system kami nerve po khanin chatna tam tak anei ta chung ho chu kami beng riat na chaklo tan chuanin ei tur ani chu kong ru na hung sang na chun tu na ka soi ne khan ei nang don thawa achan chu kami nangman zum thum nei lo chuanin arthobase ei thei thawa chuan arthobase ei pa khanin calcium te ei pa del theya gulong kha ei thei bok ani chu ase nangman zum thum nei chuanin naturopathy ei ngai ni chu
During breastfeeding, we cannot give any products except we can give asparose, but that too one tablet only in one day. We can give calcium one tablet in a day. Apart from this, we cannot give other products. As in pregnancy, other products might increase the uterine contractions, and that will be a problem for the baby. So there might be chances of miscarriage too. So we will, in those cases we can give wheatgrass. Wheatgrass is very essential in pregnancy and also in lactation. We can give wheatgrass 2 tablets morning and night. We can give asparose 1 tablet. We can give calcium 1 tablet. We are keeping the doses a little bit less so that we can't take risk with their life. And also in case of breastfeeding, if the mother is having any problem, any disease, say for example, disease of the liver or heart or kidney or anything, we cannot directly give the product to the mother, because if we give product, it might affect the baby too. In case of lactating mothers, because the breast milk, the baby will be drinking the breast milk, so there might be problem in that. There might be increased or raised body heat in the mother, which will affect the baby. So generally, we don't give any other product apart from these 3 during pregnancy and even during lactation period. If it is emergency and the mother has to take the supplements, then the breastfeeding has to be stopped. Since that is not possible in most of the cases, so we generally don't suggest it. But if the mother is not breastfeeding, or else, or if she has stopped breastfeeding, say for about a month or so, and the baby is being fed with milk or any other milk, then the mother can take. But if and while she is breastfeeding, normally we don't suggest any of the products.
Oh, now the belai rai tang han zone ma pe thei lo ba kami today and pe kon today now ina today an hei thakhat nuwa emi Oriens product se pe ka thei chawa taka nakara nei neutral ni zone asparose 1 tablet te pon ei kama se kha po kha ei ram chuan ei lo an ei lo pe shi chuan ala thasok tho tho achan chu nu le no te chu in zom tam tak an nei ta tui nai chu now khan in atu te thek na khan in kim ka ke chok ka don ho ka kha no te kha nge anum na kha exam an ta lo din na phosphorus le wheatgrass le calcium khan me ta rai la e to e chu apak dang kha chu an pe thei lo wa achan chu an ma ni khan har sat na complications of thing ya om se chu an chu te kha lo song ne ya contraction kan ti mo ka ding ta lo theng kai ka.
So ulcers, we call it peptic ulcers. So it might be in the stomach or it might be in the first part of our small intestine, which is called duodenum. Ulcers might be because of infection by H. pylori, or it might be because of other factors too, like improper diet. If we are not having food at proper time, or if we are consuming more spicy food, etc., there might be damage, there might be ulcer. If we are taking certain allopathy medicines, non-steroidal anti-inflammatory drugs, etc., it might lead to ulcers. So, whatever may be the cause, if we develop ulcer, we will have pain in the chest or in the stomach region. Depending upon where we have the ulcer, the pain also will vary. If we have ulcer in the stomach, we will have pain when we don't eat anything. When we are hungry, we will have pain. There will be HCl, acid secretion. It will come in contact with the ulcers and we will feel severe pain. Once we eat food, the pain will come down. If it's in duodenum, the first part of the small intestine, after the stomach we have small intestine, we will get pain after around 40 minutes or 1 hour or 1.5 hour after.
Kan pumpuya le kan ril te intranala ya khanin ulcer kha om thinta om zia chonin ulcer shik nei kan ti chuan H. pylori infection ti na le meita ma se khami infection pon lam thil khami infection mai ni lo khan kan thil ei le ina tang pho khanin pumpui ulcer hi chu kan nei thinta om zia chuanin along pumpui chung kha aron long ulcer khana ron ta khami khanin anat hun zual tur chu korwa lai pumaro khanin pum kha anakal ngoi oyanga khami pumaro pe chonin HCl kan ti hydrochloric acid kha aronin secrete ta hydrochloric acid chu kan thil ei zong zong ti troi tu lo digest tu kha anita mase khami acid kha ni ulcer lai kha aron chopol pe chonin anna le zual do na pum kha khami ulcer chawa anna pia lama khan khang zong zong atang khanin kan ei le in po kan film kur angai ani chu chuan khami pumpui ulcer atang khan enge damdoi a khan chi sang sang combination pro kha athan be theita khanga khanin enge infection kha alo om chuanin premium garlic kha aman tel theya chuan aloe vera khanin chihnia omta aloe vera premium le aloe vera gold omta premium handa tur chu pumpui thalo le tinanin samlam pangamo funlam pangamo bo ni se khanga khan aloe vera premium kha man theita ti chuan aloe vera gold ta kha chuanin hemi medicinal plant shan kha mixture kha atel ta ashwagandha kan tiang hovel brahmi kan tiang hovel kha khanga khan tinanin stress anxiety te khatiang ril lampanga har satna timeang khang kha atel khanin aloe vera gold kha atangkai le zual chonin pumpui le skin le hair ringot ani khan aloe vera premium kha man thei ni chu chon infection khanin enge premium garlic kha kha ayang lo theya chon pumpui ulcer tang khan ti sen te lo chuak se bleeding internal bleeding te om chuan HB kha lo niam do na in ek te kha alo anga thi sen chuak limani chuanin in eka khan thi sen kha ron tel me anga ma se ulcer awanga pumpui chunga thi sen chuak ma se hlui to si ni chuanin in ek rong kha dum lampangin in ek kha dum don ta khamia khan HB te alo niam pal theya khata khan wheatgrass eitel bok tur ani chun tin pa kha shemen tur chu chuak lampanga har satan nei chuanin aloe vera juice kam nei ate pati premium aloe vera le chu shitlang ni mo chopla pa har satna ni mo kati kha ati sual thei kati ngan nei ni chuan aloe vera juice le aloe vera gold kha kamia kha pack lo thang thang tu kamia kha ni 7 wonders juice te po pack theya tea tree te po kha pack thei so kan chu chuan honey kan ti ang ho kha pack thei po.
So, in case of heart diseases, as I already told in the morning, we are supposed to start with D-lipo. In case of ischemic heart disease, so there is some obstruction in the blood flow. The circulation has to be proper, and if it is related to blood vessels, fat being deposited in the blood vessel, or there is plaque or any thrombus, etc., which is blocking, it takes a little time. For example, even if it is cholesterol, we need to take it for a considerable amount of time. Only then the symptoms and the values start to show positive result. So, if anyone is taking D-lipo for heart-related issues, the best combination in this case would be D-lipo, total antioxidant, wheatgrass. Along with that, Vichy Ganoderma is important for maintaining pressure and cholesterol and all those issues. Further, the same can be continued because as we know, supplements are not directly and only medicines. These are for our body. So, even if we feel better, we can still continue to take that so that we don't have any complications of that disease in the future. So, we can continue using D-lipo. It helps in providing nutrients and oxygen to each and every cells of our body, and as we age, naturally the blood vessels weaken, the elasticity is lost, blood pressure issues arise. So again, that has an effect on the heart too and the brain too. So we can continue with D-lipo, wheatgrass, total antioxidant, and Vichy Ganoderma. If the person is absolutely fine, no any issues, 2 or 3 products might be enough. If there is any additional complaint, like for example, if there is joint related problem, joint pain, etc. Joint pain might be because of many reasons. It might be because of more weight, more pressure on the knee joint. It might be because of age. The bones have cartilage which covers the surfaces of 2 bones, so that there is no friction. There might be cartilage damage, there might be decrease in the mineral content, less calcium, that is important. So there might be arthritis or infection, there might be autoimmune condition, there might be deposits of uric acid, etc. So many conditions are there. But for joint related problem, we can use Artho-Best, but we should see if the patient has sugar or not. If the person has blood sugar or diabetes, we will not use Artho-Best. Instead, we will use the other products, like we will use Natural Vita. It has Challaki, which is Boswellia serrata, it is boswellic acid, which will decrease inflammation. It acts on respiratory system. Along with that, it acts on the skeletal system too. So, if anyone has diabetes, we can use, if anyone has joint issues and diabetes, in that case we can use Natural Vita, we can use calcium, we can use total antioxidant, and we can use Ayurveda product Gugul. That is very important. In all the Ayurveda products, among the 9 products, using Gugulu in any inflammation process or those kind of disease involving the joint is very important. If the person doesn't have diabetes, then we can start with Artho-Best only. We can add Artho-Best, we can add Natural Vita, we can add calcium, we can add Gugulu. We can also use joint tone oil for external application.
Of course, D-lipo kha e to po normal ang man har satna kinai to lo ni po in ila i chun som zel thea ni kin zela har satna kami thau chia po awanga ischemic heart disease kan ti lungna lung chalo kan nei thina kha khaten kha chen to lo na D-lipo kha ilo i chun som zel thea chumi mei pa ka chuani total antioxidant te wheatgrass te e gop thei bok ta ti chuan khu bruna akhan om sia chuan in kan khu bru na hi achan ni chi sang om theia thau tuk wanga taksai na azo tok aya ri awanga khu bruna om theia chuan apatina chuan gaut kan ti te uric acid sang lu tuk te hati te kha om thei ta ni chuan abaka chuan in enge ru osteomyelitis kan ti te ru chuk tu lo moi sel lo kan ti te atlak tuin bizo hi kan soi bellok nga namani ta na incline te namani ina awareness in ne kuna po bizo hi kan orthopedic surgeon te viral matanga local te ina soi tam berzu bizo te hi enge surgery englo bizo te hi min sai dia ti me bizo te hi min sai kan ru hi amoi tlang pui in ru density hi achelu to kan achan chu mizoram ma choni kan te live training viral mangin bong hote kan in thalawa sabram angte viral angte in viral te sabram ate chuanin zing an tholim vel bong hote an faten in tira tlaya an in tir boka chunai in tir boka hatin kharin bong hote ne in som lian ta chu ta chuanin an ru density te khan nei thapi kan mizo ai man mizo te chu thingpui sia no to bong hote kan in ru chun rik fok ani meya chuwang chu no pan lai tranga calcium supplement te khaten vitamin D supplement te kan nei than to awangin khami khu bruna khanin calcium te apek theya chuan apakhat le poi mo chun arthobes ki omani arthobes akha khu bruna te chong kan lo peris tok tok mai thei ma se zunthum an nei chuan arthobes akha pek lo tu ani chu chuan zunthum an lo ne ni chuanin naturovita kha zunthum an nei chuan khu bruna ta pek zong tu naturovita yen ka taksa skeletal hemi ru zong hemi system akha kami system chuan kan na a thok ve tho awangin naturovita kha ni ka taksa ka nutrients poi mo zong te apro timeng min pek pa ka khan hemi kan ru sham system akhani athok boka naturovita kha zunthum le ru chuk to na an ne ko chon arthritis ani mo gout ani mo po churi se naturovita kha kan petur nia chon ma se zunthum ten le lem lo chon in arthobes kha apek thei tho dinani chu
in paralysis mainly we'll have loss of voluntary muscle movements. Like for example, the muscles which we can move. We have muscles all over our body. We have around 650 muscles in our body. Among those muscles, some are the muscles which we can move like in our hands, legs, etc. Some we can't move which are associated with the organs inside our body. So what happens in paralysis is, suppose there is some injury to the brain or maybe to the spinal cord, it might lead to paralysis. In stroke, as I have already told, there is blockage of blood supply. In hemorrhage, there is bleeding, there is bursting of blood vessels, there is bleeding, there is loss of blood supply. So, in people who have hypertension or more blood pressure, high blood pressure, one of the complication is stroke and the resultant complication is paralysis. Our brain is affected. So, as brain is the organ which controls each and every function in our body, what we feel, what we see, how we eat and swallow, how our food is digested, how we pass urine, stools, everything is being monitored by the brain. We have nerve supply all of our body. How we see, what we think, our memory, everything. So our brain has different parts which control different functions. So if those particular areas are affected, some people may have problem with speech, some may not be able to move their hands and legs, some may forget everything, memory might be affected. So depending upon which part, which side is affected. So if it is in paralysis too, it might be only the lower limbs, I mean the legs are affected, upper body is perfectly fine. It might be one side, the hand, the left side hand and leg is affected, or the right side is affected, or it might be the whole body. So it all depends. But in case of paralysis or stroke, what is important is how we improve the brain function and the blood supply. Because even in paralysis, there will be muscle weakness too. We need to give something which returns the strength, which improves the circulation. Circulation is important for everything.